I'm Kayleigh Wright. I'm the trauma nurse coordinator here at Delta Health, and we are going to be doing trauma talks. Trauma talks are a collaborative effort between Delta Health, Montrose Regional Health, Gunnison, Telluride Medical Center, and St. Mary's, as well as Community Hospital. We all gather data and come up with injury prevention topics, and we put them in a trauma talk. So this month's trauma talk is going to be on car seat safety from birth through adolescence.
So rear-facing car seats are important for children because they have large heads and immature spines. With that, if you're in an accident, they're more likely to injuries to those areas, which can be fatal or, very, very severe in nature. It is important to keep your children rear-facing until they reach the weight or height recommendations that's listed on the car seat. Sometimes that's upwards of 2 years old. It just depends on your child's size, height, and weight. Forward-facing car seats, when you switch your child to that position, it's still important to use the 5-point harness. With that, it's a little bit different the way it sets up, but your harness should sit right at your armpit level still. It should be secure at the hips, and you don't want the belt to be able to pinch. So you don't want to be able to pinch the slack in the belt. You want it to be able to be tight and secure just like you would a rear-facing. And they need to stay in that until they can safely sit in a shoulder belt that doesn't hit their neck. So there's also height requirements for that and weight requirements for that. Also, you don't want to turn your child forward facing, once again, until they reach that weight and height limit that's listed on their car seats. So you don't want to wear winter coats with a car seat. The reason being it adds that extra room. Without a winter, if you put your child in a car seat with a winter coat, you're creating an additional space that the belt will not tighten properly. So if you're in an accident and you have that extra space, your child is more likely to be injured in the impact of that accident. So your booster seat is your transition in between a front-facing seat with the 5-point harness and just a regular seat like how most adults sit. You should not have your child in a seat without a booster seat until they can properly sit with their knees against the seat, their feet flat on the ground, their shoulder belts not on their neck, and it's positioned appropriately. Most booster seats are recommended until also a specific weight and height and until your child can fit safely in a regular seat. If you have questions regarding your car seat and installation, and if your seatbelts are appropriate, you can always reach out to your local fire departments, Colorado State Patrol. These facilities are certified in car seat safety, and they can walk you through the appropriate installation and usage of seatbelts as well.